the controlled substance drugs. In this module, we'll learn about the 5-panel drugs, their facts and risks, and signs of use. The 5-panel drugs. The DOT has listed a 5-panel drug test regime for marijuana, THC, cocaine, opiates, phencyclidine, PCP, and amphetamines, including methamphetamines. Marijuana, cannabinoids, introduction. Marijuana is one of the most misunderstood and underestimated drugs of abuse. People use marijuana for the mildly tranquilizing, mood, and perception-altering effects it produces. More on its description. Generic chemical name: dronabinol, marinol, nabione. Common street names: pot, dope, grass, hemp, weed, hooch, herb, hash, joint, Acapulco gold, reefer, sensimilla, Thai sticks. Distinguishing characteristics. Like tobacco, marijuana consists of dried, chopped leaves that are green to light tan in color. The seeds are oval with one slightly pointed end. Marijuana has a distinctly pungent aroma resembling a combination of sweet alfalfa and incense. Less prevalent, hashish is a compressed, sometimes tar-like substance ranging in color from pale yellow to black. It is usually sold in small chunks wrapped in aluminum foil. Paraphernalia: cigarette papers, roach clip holders, and small pipes made of bone, brass, or glass are commonly found. Smoking bongs, large bore pipes for inhaling large volumes of smoke, easily be made from soft drink cans and toilet paper rolls. Method of intake. Marijuana is usually inhaled in cigarette or pipe smoke. Occasionally, it is added to baking ingredients, brownies, and ingested. Tetrahydrocannabinol, THC, the active chemical detected in your analysis, is released by exposure to heat. Effects of marijuana or cannabinoids. The most obvious effects are felt for 4 to 6 hours. Preliminary studies suggest that performance impairment lasts longer. The active chemical THC is stored in body fat and slowly metabolized over time. Let's learn more about the effects of marijuana use on the individual at 3 levels. General health effects. When marijuana is smoked, it is irritating to the lungs. Chronic smoking causes emphysema-like conditions. One joint causes the heart to race and be overworked. Lowers the body's immune system response, making consumers more susceptible to infection. Did you know marijuana can also cause pregnancy problems and birth defects? Effects of marijuana on mental functioning. Regular use can cause the following effects: delayed decision-making, diminished concentration and impaired short-term memory, impaired signal detection, ability to detect a brief flash of light, impaired tracking, the ability to follow a moving object with the eyes, and visual distance measurements, erratic cognitive function, distortions in time estimation, long-term negative effects on mental function known as acute brain syndrome, which is characterized by disorders in memory, cognitive function, sleep patterns, and physical condition. Now, how severe is the effect of marijuana on driver performance? The mental impairments resulting from the use of marijuana produce reactions that can lead to unsafe and erratic driving behavior. Distortions in visual perceptions, impaired signal detection, and altered reality can make driving a vehicle very dangerous. We will now discuss some of the facts related to cocaine. Cocaine is used medically as a local anesthetic. It is abused as a powerful physical and mental stimulant. The entire central nervous system is energized. Muscles are more tense, the heart beats faster and stronger, and the body burns more energy. The brain experiences an exhilaration caused by large release of neurohormones associated with mood elevation. Description. General and or chemical names: cocaine hydrochloride or cocaine base. Common street names: coke, crack, snow, blow, flake, C, toot, rock, base, nose candy, snort, white horse. Paraphernalia: cocaine hydrochloride, single-edged razor blade, a small mirror or piece of smooth metal, a half straw or metal tube, and a small screw cap vial or folded paper packet containing the cocaine, used for snorting, needles, tourniquets, used for injecting, cocaine bacilla, crack pipe, small glass smoking device for vaporizing the crack crystals, a lighter alcohol lamp, or small butane torch in the substance. Method of intake: cocaine hydrochloride is snorted into the nose, rubbed on the gums, or injected into the veins. Cocaine base is heated in a glass pipe and the vapor is inhaled. What are the effects of cocaine use on the individual? Let's start with discussing physical effects. Research suggests that regular cocaine use may upset the chemical balance of the brain and may speed up the aging process by causing irreparable damage to critical nerve cells, leading to onset of nervous system illnesses such as Parkinson's disease. Cocaine use causes the heart to beat faster and harder and rapidly increase blood pressure. In addition, cocaine causes spasms of blood vessels in the brain and heart. Both effects lead to ruptured vessels, causing strokes or heart attacks. Strong psychological dependency can occur with one hit of crack. Usually, mental dependency occurs within days of using crack or within several months of snorting coke. Cocaine causes the strongest mental dependency of any known drug. Cocaine is extremely dangerous when taken with depressant drugs. Death due to overdose is rapid. The fatal effects of an overdose are not usually reversible by medical intervention. The number of cocaine overdose deaths in the United States has tripled in the last 4 years. Some effects on mental performance are also shared. Chronic use of cocaine causes paranoia and hallucinations, hyperexcitability and overreaction to stimulus, difficulty in concentration, wide mood swings, and its withdrawal leads to depression and disorientation. Let's discuss in detail the effects of cocaine on driver performance. Cocaine use results in an artificial sense of power and control, which leads to a sense of invincibility. Lapses in attention and the ignoring of warning signals brought on by cocaine use greatly increase the potential for accidents. Paranoia, hallucinations, and extreme mood swings make for erratic and unpredictable reactions while driving. The high cost of cocaine frequently leads to workplace theft and/or dealing. Forgetfulness, absenteeism, tardiness, and missed assignments can translate into lost business. What are the signs and symptoms of using cocaine? Evidence of presence cocaine: small folded envelopes, plastic bags, or vials used to store cocaine, razor blades, cut off drinking straws or rolled bills for snorting, small spoons, heating apparatus. Physical symptoms include dilated pupils, profuse sweating, dry mouth, tremors, needle tracks, loss of appetite, hyperexcitability, restlessness, high blood pressure, heart palpitations, insomnia, talkativeness, formication, sensation of bugs crawling on skin. Behavioral symptoms: increased physical activity, depression, isolation and secretive behavior, unusual defensiveness, frequent absences, wide mood swings, difficulty in concentration, paranoia, hallucinations, confusion, false sense of power and control. Let's now discuss opiates or narcotics. Opiates, also called narcotics, are drugs that alleviate pain, depress body functions and reactions, and when taken in large doses, cause a strong euphoric feeling. Description: generic or chemical names. Natural and natural derivatives include opium, morphine, codeine, and heroin. Semi-synthetic. Synthetics include meperidine, Demerol, oxymorphone, numorphin, and oxycodone, percodan. Common street names: Big M, Micro, Dots, Horse, H, Junk, Smack, Skag, Miss Emma, Dope, China White. Distinguishing characteristics: because of the variety of compounds and forms, opiates are more difficult to clearly describe in terms of form, color, odor, and other physical characteristics. Opium and its derivatives can range from dark brown chunks to white crystals or powders, depending on the method of intake. They may be in powder, pill, or liquid form. Paraphernalia: needles, syringe caps, eyedroppers, bent spoons, bottle caps, and rubber tubing used in the preparation for and injection of the drug. Method of intake: opiates may be taken in pill form, smoked, or injected depending upon the type of narcotic used. Effects of opioids use on the individual. IV needle users have a high risk for contracting hepatitis and AIDS due to the sharing of needles. Increased pain tolerance. As a result, people could more severely injure themselves or fail to seek medical attention after an accident due to the lack of pain sensitivity. The effects are multiplied when used in combination with other depressant drugs and alcohol, causing increased risk for an overdose. Effects on mental performance: depression and apathy, wide mood swings, slowed movement and reflexes. In addition, the high physical and physiological dependence level of opiates compounds the impaired functioning. Effects on driver performance: the physical effects, as well as the depression, fatigue, slow reflexes, impede the reaction time of the driver, raising the potential for accidents. Although opiates have a legitimate medical use in alleviating pain, workplace use may cause impairment of physical and mental functions. Unwanted side effects such as nausea, vomiting, dizziness, mental clouding, and drowsiness place the legitimate user and abuser at higher risk for an accident. Let's now learn about PCP, phencyclidine. Phencyclidine, PCP, was originally developed as an anesthetic, but the adverse side effects prevented its use except as a large animal tranquilizer. Phencyclidine acts as both a depressant and a hallucinogen, and sometimes as a stimulant. It is abused primarily for its variety of mood-altering effects. Low doses produce sedation and euphoric mood changes. The mood can change rapidly from sedation to excitation and agitation. Larger doses may produce a coma-like condition with muscle rigidity and a blank stare with the eyelids half closed. Sudden noises or physical shocks may cause a freakout in which the person has abnormal strength, extremely violent behavior, and an inability to speak or comprehend communication. Description: general or chemical names. Phencyclidine. Common street names: angel dust, dust, peace pills, hog, killer weed, mint, monkey dust, supergrass, tranquil, weed. Distinguishing characteristics: PCP is commonly sold as a creamy granular powder. It is either brown or white and often packaged in 1-inch square aluminum foil or folded paper packets. Occasionally, it is sold in capsule, tablet, or liquid form. It is sometimes combined with procaine, a local anesthetic, and sold as imitation cocaine. Paraphernalia: foil or paper packets, stamps, off which PCP is licked, needles, syringes, and tourniquets for injection, leafy herbs for smoking. Method of intake: in pill, capsule, or tablet form, PCP may be ingested. It is commonly injected as angel dust. It may be smoked or snorted when applied to leafy materials or combined with marijuana or tobacco. detailing more about the health effects of phencyclidine. The potential for accidents and overdose emergencies is high due to the extreme mental effects combined with the anesthetic effect on the body. PCP is potentiated by other depressant drugs, including alcohol, increasing the likelihood of an overdose reaction. Misdiagnosing the hallucinogens as LCD-induced and then treating with Thorazine can cause a fatal reaction. Use can cause irreversible memory loss, personality changes, and thought disorders. There are 4 phases of PCP abuse. The first phase is acute toxicity. It can last up to 3 days and can include combativeness, catatonia, convulsions, and coma. Distortions of size, shape, and distance perception are common. The second phase, which does not always follow the first, is a toxic psychosis. Users may experience visual and auditory delusions, paranoia, and agitation. The third phase is a drug-induced schizophrenia that may last a month or longer. The fourth phase is PCP-induced depression. Suicidal tendencies and mental dysfunction can last for months. Phencyclidine also causes severe effects on mental performance, irreversible memory loss, personality changes, thought disorders, hallucinations. More on its effects on driver performance. The distortions in perception and potential visual and auditory delusions make driver performance unpredictable and dangerous. PCP use can cause drowsiness, convulsions, paranoia, agitation, or coma, all obviously dangerous to driving. What are the signs and symptoms of using phencyclidine? Evidence of presence of PCP: packets, stamps, injection paraphernalia, herbs. Physical symptoms: dilated or floating pupils, blurred vision, nystagmus, jerky eye movement, drooling, muscle rigidity, profuse sweating, decreased sensitivity to pain, dizziness, drowsiness, impaired physical condition, for example, drunken-like walk or staggering, severe disorientation, rapid heartbeat. Behavioral symptoms: anxiety, panic, fear, terror, aggressive, violent behavior, distorted perception, severe confusion and agitation, disorganization, mood swings, poor perception of time and distance, poor judgment, auditory hallucinations. Let's begin with some facts about amphetamine. Amphetamines are central nervous system stimulants that speed up the mind and body. The physical sense of energy at lower doses and the mental exhilaration at higher doses are the reasons for their abuse. Although widely prescribed at one time for weight reduction and mood elevation, the legal use of amphetamines is now limited to a very narrow range of medical conditions. Most amphetamines that are abused are illegally manufactured in foreign countries and smuggled into the United States or clandestinely manufactured in crude laboratories. For a clearer understanding, the generic or chemical names include amphetamine and methamphetamine. Trade names include Desoxin, Dexapex, Fastin, Fastolatin, Dexedrine, Delcobis, Phetamine, Obertrol. Common street names include Uppers, Speed, Bennies, Crystal, Black Beauties, Christmas Trees, White Crosses, Mollies, Bam, Crank, Meth, Ice, LA Ice. Distinguishing characteristics: in their pure form, amphetamines are yellowish crystals. Amphetamine, speed, is sold in counterfeit capsules or as white, flat, double-scored mini bennies. Methamphetamine is often sold as a creamy white, granular powder or in lumps wrapped in aluminum foil or sealable plastic bags. Paraphernalia: needles, syringes, and rubber tubing for tourniquets used for the injection method. Method of intake: the most common forms of amphetamines are pills, tablets, or capsules which are ingested. The less frequent forms, liquid and powder, are injected or snorted. Effects of amphetamine use on the individual's physical health includes strong psychological dependence and increasing tolerance to drug, Intoxication may induce a heart attack or stroke due to spiking of blood pressure. Chronic use may cause heart and brain damage due to severe constriction of capillary blood vessels. The euphoric stimulation increases impulsive and risk-taking behaviors, including bizarre and violent acts. Long-term heavy use can lead to malnutrition, skin disorders, ulcers, and various diseases that come from vitamin deficiencies. Lack of sleep, weight loss, and depression also result from regular use. Other than these physical effects, the worrisome aspect is the adverse effects on mental performance like anxiety, restlessness, moodiness, false sense of power. Large doses of substance over long periods can result in hallucinations, delusions, paranoia, brain damage. What are possible adverse effects on driver performance? Amphetamines cause a false sense of alertness and potential hallucinations, which can result in risky driving behavior and increased accidents. Drivers who fail to get sufficient rest may use the drug to increase alertness. However, although low doses of amphetamines will cause a short-term improvement in mental and physical functioning, greater use impairs functioning. The hangover effect of amphetamines is characterized by physical fatigue and depression, which can make operation of equipment or vehicles dangerous. What are the signs and symptoms of substance use? Evidence of presence of amphetamines. Most frequently pills, capsules, or tablets, envelopes, bags, vials for storing the drug, less frequently syringes, needles, tourniquets. Physical symptoms: dilated pupils, sweating, increased blood pressure, palpitations, rapid heartbeat, dizziness, decreased appetite, dry mouth, headaches, blurred vision, insomnia, high fever, depending on the level of dose. Behavioral symptoms: confusion, panic, talkativeness, hallucinations, restlessness, anxiety, moodiness, false sense of confidence and power, amphetamine psychosis, which might result from extended use. See health effects.